Mississippi certainly has its challenges. As a state that is 50th in access to healthcare and wellness, a state whose graduation rates are 78%, a state who consistently is at the bottom of the ranking in poverty. We have 6,000 children now in the child welfare system. Where this begins to intersect in our work is we have 1 in 5 children in this state with significant mental health challenges. And that represents 131,000 children in Mississippi. The more alarming statistic, even worse than 1 in 5 with a significant problem, is that 80% of those children never receive care. So that's 100,000 children in our state who never receive the care that they need. I like to think of that in terms of healthcare, which most of us understand. If we said 1 in 5 children have cancer now, the headline read 1 in 5 children now have cancer, that would grab everyone's attention. The bigger headline would be 80% of those children never receive treatment. We wouldn't tolerate it. And so one of the big challenges our state faces is making sure every child gets access to health care. And we believe that health care includes mental health care. We don't separate out and say physical health care. We really shouldn't separate out and say mental health care. Health care is to make sure every child is healthy, that every child receives the treatment and care that they need when they need it, and that every child can be a success story. And that's what we're working with everything we have to make sure it happens. We provide a full continuum of care for children, which means we want to view the problem that the child and family is having and offer the appropriate solution at the level of intensity it's needed, for the length of time that it's needed, with the right professionals that are needed to bring about a solution to that particular problem. We operate a full continuum of services, which means we can think about what is the best service for this child at this time. And if we don't provide it, we want to make sure the family's connected with someone who does provide that service. For us, that continuum of care at the least intense, we have prevention services and education, and we do adoption, we do foster care, we do outpatient services, we have shelters for those who are in crisis, we have a whole psychiatric residential treatment for those who are in need for more intense, longer term care. And in between, we also have education services to make sure that we have children in their own home and community that need help and assistance. They can't function in their local public school, that we can come alongside them and make sure that they come to our school and get back to the public school as soon as they can. It's this continuum of care that we operate with very passionate, mission-driven staff who are going to make sure that the best interest of the child and family are served, that make sure that we bring the important people in that child's life into the solutions and wrap services around them. That might be, of course, the family, but it might also be the youth minister or the coach or the math teacher or the grandmother, aunt, the friend. We want them at the table because they're going to go on to help them be successful and to thrive. We want to create a sustainable change that over time this child can thrive, this family can do well, and that we know we've accomplished our goal when that child is thriving and that family's overcome that extraordinary challenge that brought them to us to begin with.